Let's look at the dissection of anterior compartment of thigh. It has four muscles. This is Sartorius muscle. It originates from anterior superior iliac spine. It runs down obliquely from lateral to medial side and inserts into the medial surface of the shaft of the tibia on the upper part. It helps in flexion of hip and knee joint. This is Quadriceps femoris muscle. It has four muscles. And the first one is Rectus femoris. It has two heads, straight and reflected head. They join to form a bipinnate muscle and inserts into the patella. It helps in flexion of hip and extension of knee joint. Other muscles are vastus medialis on the medial side and vastus lateralis on the lateral side. If we lift this rectus femoris, underneath we can see vastus intermedius muscle. All four muscles together they form quadriceps femoris and gets inserted into the patella, and through ligamentum patellae it gets inserted into the tuberosity of tibia. They help in extension of knee joint. This is tensor fasciae lata muscle, origins from outer lip of iliac crest, from anterior superior iliac spine to the tubercle of iliac crest, and it gets inserted into the iliotibial tract. Other muscle is articularis genu, which is considered as part of vastus intermedialis and is not visible in this dissection. All these muscles are supplied by femoral nerve except tensor fasciae lata, which is supplied by superior gluteal nerve.